The first patient brought in at 8 p.m. was already dead when they got him there. We couldn't really help him. From then until morning, we had about 8 more fatalities.
The words of a doctor describing her shift at a small medical clinic in an Iranian city on January 9th, the second day of a nationwide internet blackout ordered by authorities. The better to hide what they were doing, say witnesses.
The night before, the injuries were mostly to the waist down and with pellet shots. But that night, the first patient was hit directly in the chest. After that, all the people we got were hit by live ammunition.
Withholding her name and location and altering her voice for her protection and that of friends and colleagues still in Iran. Activists believe most demonstrators who died were killed on the first 2 nights of the internet shutdown.
The scenes were extremely horrifying. Our clothes were full of blood. The floor was full of blood.
Medical staff used to dealing with ankle sprains and flu bugs found themselves overwhelmed and under-equipped for the type of injuries coming through their door.
The patients had severe bleeding, but both they and the people with them were so afraid of going to the hospital that they refused. We kept hearing that whoever goes to the big hospitals, they'll detain them. And after that, no one knows what will happen to them.
Even before the internet blackout, there were reports of Iran's security forces seeking out protesters in hospitals and pulling them out.
The hardest part was seeing the young people who died, and I couldn't do anything for them.
The doctor dismisses government claims that outsiders were responsible for the killings.
A large number of their own forces had masked their faces and were in the streets with Kalashnikovs. I'm sure it was their own forces shooting people. I've seen their violence before.
She doesn't know if she'll be able to go back. Medics who helped the injured reportedly also being sought by security forces. They came to her clinic after she left, she says, taking the CCTV footage.
So they can identify anyone who has helped the injured.
One network of medical professionals in Iran has predicted the number of dead could top 30,000. The doctor believes it's possible, citing an ambulance driver who told her he'd moved some 500 bodies to a cemetery in 48 hours.
There wasn't enough space for the bodies, so they had to put all of them in a container. If this happened in our area, surely it's the same in other places.
The doctor says she has no idea what to do, that Iranians feel desperate. She says she's spending her days with the hope that this regime falls.